Hi, Dr. Pelto here. I want to go over today a new book that I'm excited about sharing with everyone. It's a book that I put together for my patients because basically before I was using many different resources kind of separate on the post-wire page, if you've seen a lot of the links that I've shared in the past. This is called the Plantar Fasciitis book, and it's a compilation of all these other resources that I think are much better than putting everything piecemeal together. So I want to offer this. It'll be at the bottom of the video for you guys. I'd like your input as well if there's anything that you'd add, you change. But let me give you a little review of the book. It's called the Plantar Fasciitis book, and I want to start with the copyright. Don't steal all this. If you want any permission, you can certainly send me an email to use some of this. There's a couple of things I'm real excited about. The introduction isn't any different, really, than most books. It talks a little bit about plantar fasciitis, why I kind of put it together. But the interesting aspect that I've added to this book are these clickable videos. So if you click it, it'll go right to YouTube, and it'll go to one of the video explanations of plantar fasciitis that I had made before in the past. So that's something that's a little bit different about this video, about this book. The outline explains what plantar fasciitis is, the symptoms, the causes, diagnosis, and then something I put together called the Plantar Fasciitis Treatment Evaluator. The reason I put this together is because many times when you look online, there's a lot of different treatments and you're not really sure how to evaluate what's the most effective. And that's where I like to spend most of my time. All the other treatments are things that you can find online, and then some other checklists that I put together. So what is plantar fasciitis? Most of you know that it's caused by an inflammation on the bottom of the heel, not usually the spur. I'm not going to read this whole book for you, but you can read it. Some of the symptoms, some of the causes, some videos, some images that I put in here, kind of explaining the different diagnostic treatments such as an X-ray, diagnostic ultrasound, or an MRI. And here's the treatment evaluator. It really divides treatments into different categories, such as reducing inflammation, reducing tightness, and stabilizing the foot, and reducing pressure. And I want to really explain that icing is not effective as a cortisone injection. Similarly, supportive shoes aren't effective as a custom orthotic. And much of the information you're going to find is important, but it's not all that effective. So this is the gist of it. The Plantar Fasciitis Treatment Evaluator. I put here on the left side the effectiveness scale, so 5 being the most effective, 3 moderately effective, and 1 being least effective. And you may ask, well, doctor, how did you make this? Well, I made it just out of my training and also practicing the last 10 years what works with my patients. And so I get a lot of people, they come in, and they're really doing a lot of the least effective things, and they want to get better, and they're not getting better, and they really want to avoid the most effective. So let's look first of all at what are some of the least effective things. So using like a topical pain reduction cream, icing, and contrast baths. Now the reason I put platelet-rich plasma here, you might be shocked, well, everyone's doing it now. Well, but in my experience in the foot, it's not as effective as some of the new things that we have. There's oral non-steroidal anti-inflammatories. Then you get to a steroid anti-inflammatory like prednisone. Then you get to amniotic membrane therapy, then shockwave, then cortisone injection. So in my hands, I find that the cortisone injection has the best benefit. It's the most effective at reducing inflammation. Okay, if you don't have one or don't want to have one, then the next step would be shockwave. Now, there are a few caveats and pros and cons with each of these, and you'll find later on as I explain each aspect. We'll talk about inflammation, tightness, reducing pressure. I also put pros and cons. So what are the benefits and the contraindications? For example, the number that you can have. What are the problems? It kind of delays other types of treatment. So for example, with cortisone, I don't like to do the shockwave therapy for 2 months after because you don't want to, the shockwave wants to increase inflammation and cortisone reduces inflammation. The next focus is reducing tightness. So I find a lot of people, they spend all this money online and they buy a Strasbourg sock, a night splint. They try stretching. And a lot of that doesn't really work to reduce the tightness in both the bottom of the heel, but mostly in the back of the leg. And I recommend focusing more on home therapy, foam rolling stick, trigger point tools, and then physical therapy, the most effective. And as well, stabilizing the foot and reducing pressure. People try a lot of things like compression sleeves, padding, strapping, supportive shoes. All these are important, but I find that really custom orthotics work the best to reduce the inflammation and stabilize your foot. But if you're in a lot of pain, even better than an orthotic is a walking boot to really rest the area. So I kind of delineate the effectiveness of these things, and then you go down and it talks about each of these treatments, has some pictures. For a lot of these, there's patient handouts, there's videos. For example, there's a video here that we recorded on shockwave therapy. It'll take you to another YouTube video here you can watch about shockwave. This is 3 of my partners here were talking about shockwave, or 2 of my other partners here were talking about shockwave. It goes down here as well about amniotic membrane therapy. We interviewed and talked about that. Anti-inflammatory medications, different ways to ice. There are some handouts on contrast baths and icing, and all these handouts are connected here. So if you want to look at these handouts, you can just click this link here, and it'll go to a couple of handouts, like for example on how to ice properly. Okay, here's different handouts that we put together for our patients. Going down, talk about reducing tightness. Talks about the Graston technique, which I think is one of the best things, and it also shows the tool itself. So I've put some links here to Amazon. So if you wanted to buy the tool, see what the tool looks like, there's different exercises that you can do, different videos you can find on how to do that. Trigger point tools, which I think are very effective. There's some links as well, and also some videos that I teach how to use the trigger point tools right here. The foam roller, for example, if you click here, it's going to give you a link that you can show where to get the foam roller. But more than that, here's a video where I put together on how to teach you how to foam roll properly. So it's going to go in and talk about the anatomy, foam rolling exercises on an actual patient there. And it has it the same for the trigger point tools, for the stick, some stretching exercises with some explanations as well. And then some of these other ones that I did talk about, but they're less effective, but I put them in order of effectiveness, and as well with different pros and cons for the Strasbourg sock, stabilizing the foot with orthotics, kind of showing how orthotics work with support in the foot, walking boot, or the over-the-counter inserts, some good shoes that I recommend. What are some good shoes? Some examples, some flip-flops that have more support, some different ways to how to strap your foot, some examples, different paddings that you may consider, compression sleeve, losing weight, what I'm kind of recommending to my patients, some surgical options that might be there, preventing, video explanation, once again, that I talked about. And there are different products and different product categories, so a lot of times you don't know where to get these. Amazon is probably the easiest place. There may be some other websites, but I find Amazon pretty easy. And then at the end, there's a little plantar fasciitis checklist. This is what I use with all my patients, kind of talking about different treatment options, how to reduce inflammation, how to reduce the tightness, and stabilizing your heel. And then some frequently asked questions I get about orthotics and surgery and other types. And there's some other documents that I've included here. So hope you find this fun and exciting. I'm really excited. I'd like your feedback. I put it on the bottom here of this video. You can click it to get this ebook, and give me your feedback. Please let me know what you think, how I can make it better. And it's kind of a living document. If you look at it, it'll be a connection to a Google Doc so that I can constantly edit it and as people give me feedback on this.